Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Real glad that you could join us for another segment. We're going to be speaking with Beth Wathen this morning, the American Academy of Critical Care Nurses president and frontline nurse at Children's Hospital, Colorado. She's joining us on the program to talk a bit about AACN and what they're doing to make sure that nurses' voices are heard during this COVID-19 crisis and, well, as nurses do what they do overall. Welcome to Health Professional Radio. Beth Wathen, thanks for joining us.
Thank you for having me, Neil.
Well, if you would, give our listeners a bit of your professional background and then talk about being president of AACN briefly.
Sure. Well, I am a pediatric nurse. I've been a pediatric nurse for more than 35 years, and I have been in the pediatric ICU for the past 20 years. And I have the pleasure this year of being the president of the American Association of Critical Care Nurses, which is the largest professional specialty nursing organization in the world, and we represent the interests of acute and critical care nurses and provide them with the advocacy and clinical resources that they need to, give their optimal contribution.
Now, I did say that critical care nurses are dealing with this COVID-19 crisis. I mean, there's no doubt about that. But just being a critical care nurse without the COVID-19 crisis, before COVID-19 even happened, was still very stressful, and nurses were in need of their voices being heard.
Yeah, absolutely. Critical care nursing, I think, is a passion for all of us. We have the privilege and honor of taking care of people and their families at their most vulnerable times, and being there with them to guide them if as they're dying. And so it's what we do, it's what we love to do. But you're absolutely right. I think the nurse's voice is often one that we don't hear in media that much. The pandemic has certainly changed that because, as you know, critical care nurses have been at the front line of this grueling battle for the past 18 months. And one of the things that really concerned us is that now we're seeing nurses leaving in record numbers. And that concerns us because I think it puts the U.S. healthcare system in peril. We recently did a survey, AACN did, of our over 6,000 acute and critical care nurses, and 92% of those that responded felt that the pandemic had depleted nurses at their hospital. And 66%, so two-thirds of the nurses that responded said that because of their experiences during this pandemic, they've considered leaving nursing. And I think those numbers should really concern everybody.
When we're talking about these experiences, obviously there are the experiences of dealing with severely sick and dying patients on a much larger scale than they normally have been used to dealing with. And then there are, certain managerial things that are going on as well. Which were you hearing more of? Was it stress-related, this exodus more attributed to stress-related or management?
I think it's predominantly stress-related. Mm-hmm. I think the burden that nurses have been bearing has really been immense, both physically and emotionally. Nurses and other healthcare providers on our teams, for sure. And there's only so much that I think individuals can do. I think it's impossible to describe the level of death and despair that our nurses have been witness to over the past 18 months. And I think now it's just frustrating and heartbreaking because so many of the deaths that they're seeing now are really preventable, and that adds to that emotional burden that nurses are bearing.
When AACN is taking steps to make sure that nurses' voices are being heard, are our nurses, our critical care nurses, trying to convince everyone to get on board with vaccinations? Are they trying to say, give us a break, hire more of us? What exactly are they saying?
Well, absolutely. I think the only way out of this pandemic right now is for many more people to get vaccinated. AACN has been advocating on this, and we released a statement in August of this year, really calling for healthcare systems and long-term care employers to require vaccines of all employees, because we really believe it's the only way to end this pandemic. And so we're asking the public really to help us in this effort to end the pandemic. It's simple, right? We all know it's simple. Wear a mask indoors, keep your distance, and get vaccinated if you're eligible. And to help others in your circle do the same. And then I think also, I mentioned the nurses' stories and hearing their voices. You can we have a website, hearusout.com, where so many of the respondents of our survey wanted to be able to share their stories of what life is like on the front lines of the pandemic. And so you can go to that website and hear from our individual nurses and hear what it's been like and what this experience has been like.
Have you been hearing anything about nurses dealing with each other within their own ranks, educating each other about getting vaccinated and wearing masks and things of that nature? Is there a consensus among all nurses about vaccines, or has there been some division as there is in the, I'll say, civilian world as well?
Yeah, I don't know that there's 100% consensus. I think when you look at how many nurses are vaccinated, the latest data that we have is from a survey by the American Nurses Association, which shows 90% of nurses are currently vaccinated. We understand that people have questions about the vaccines, and I know there's still some healthcare workers out there with questions about the vaccines, but we would urge them to seek information from reliable evidence-based sources, to talk to a trusted ally or friend or health professional to get your questions answered.
I've heard that many nurses are talking with patients who are beyond help, many patients who decided not to be vaccinated, but now are saying, I've had a change of heart. What can people who go through this illness and make it out to the other side, what can they do to help support the nurses that help them?
Oh, what a great question. They can absolutely be our advocates and allies, and who better to hear that message from than someone who's gone through it and realized, wow, I didn't have to be in the ICU for 2 weeks if I had only gotten a vaccine. What's heartbreaking is when you have patients in the ICU who are begging for the vaccine, but it's too late, right? Mm-hmm. And so I think those folks that do survive this illness and get out of the hospital, they would be such awesome advocates for us to really help us share that message that the steps are simple to prevent yourself from landing up in the ICU with COVID. And what can we do to help you get to that point where you'll get that vaccine?
And I would think that the lessons that we learn with the vaccines being administered to adults, that once pediatric vaccines are approved, we would avoid some of the same mistakes with our children, I would hope.
Yeah, I would hope as well. We all know, and I think we've all seen it in the news, and as a pediatric nurse, I can attest we are seeing a rise in infections amongst our children, and children are not immune to COVID. They are being hospitalized, and some of them are dying from COVID. And so, unfortunately, right now, not all children, as you know, can be vaccinated. So I think as adults and as a community, what can we do to prevent our children from being exposed to this illness right now? And then, once the vaccines are available, we know that vaccines are safe. We know that they've eradicated other diseases. And so how do we really continue to shift that perception around these COVID vaccines and get more people on board?
Beth, give us a website where our listeners can learn more about the Academy and what AACN is doing to support critical care nurses.
Absolutely. You can go to hearusout.com to hear more about the survey that I mentioned, to hear more stories from our frontline nurses all over the country, and to understand and find resources as to how you can help us in this advocacy work.
And I believe another resource would be AACN.org. Is that correct?
Absolutely. That is our main website, AACN.org.
Well, I appreciate you joining us here on Health Professional Radio this morning. Thank you so much for this information.
Oh, thank you so much for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.